Okay, we're going to call the meeting to order. Welcome, everybody. Let's start with the approval of the minutes from way back in February 14th. Is there a motion to approve? Anne, is there a second?
Second.
All in favor?
Aye.
Great.
Seconded. Lori?
I seconded it.
Thanks.
Seconded it.
Seconded it. Great, so at this point, we're going to turn it over to Kim McNamara for an update.
Good afternoon. Today I'm going to update you on the community health profile and the needs assessment progress, and review some Portsmouth-specific data sets that are related to our vulnerable residents and students. And then I would like you to consider some recommendations that we have, and I'll go through those as well. The community health profile is 68-page document that's floating around here somewhere.
I have it.
One's headed that way, one's
So
headed
if we can pass those around, you'll see that it's in draft form, so it's not ready to be released quite yet. There are a few minor edits and a couple of additions that we hope to make, but it's just about completed. So that portion is mostly done. The needs assessment is well underway. As I informed you before, we weren't able to hire one agency to do a needs assessment, and it's a lot of work. We had to break it down into pieces, and the health department is having to do quite a bit of the work. So it's a slower process than we'd originally hoped, but we're getting some really critical information by meeting with community groups. And I expect that if all of you have not yet got a call from Maria Solari, you will soon, to set up interviews with you and get some further information. And now I'll share some Portsmouth data. The Portsmouth's race statistics are residents that identify as two or more races are 5.3% of our population. Other races, 0.96, or just a little less than 1%. 0.04% are Native Hawaiian or other Pacific Islander. 4.6% Asian Americans. 0.23% American Indian and Alaska Native. And 1.1% of us are Black or African American, yet 87.7% are white. The pie chart on the right are these statistics excluding white, just so that you can see the ratios of minorities. And here is a great visual of languages other than English that are spoken at home in the Portsmouth schools. English is not included on that, and so that you can see the number of different languages that are spoken. This is that language list actually listed out, again excluding English here. So even though our minority populations are small in Portsmouth, we do have diversity here in Portsmouth. When you add English to that list, there are 22 languages spoken in the Portsmouth schools. And remember, behind those students, there are family members at home that may solely rely on those languages and have no English skills. And our disability statistics, overall 9.9% of residents of Portsmouth report disabilities. That is 4.5% have an independent living need, 2.1% have a self-care disability, 4.3% identify a cognitive disability, 1.9% vision, 2.4% hearing.
What is a self-care disability?
Don't go so fast.
Uh,
I want to read it.
ADLs, basically, right?
Certainly, yes. So if you need help with your activities of daily living, you know, whether that's taking medication, brushing your teeth, preparing meals, any of that sort of thing.
But there must be
And can you
overlap.
speak into the microphone?
Oh, I'm sorry.
Yes.
There would be overlap, right? Because somebody
Yes.
who has a vision disability might also have a self-care.
That's right. That's why you can't just add up the numbers and come to 9.9%.
Got it.
Are you all set? And you've seen this before. This is Portsmouth age distribution, but just to keep in mind that our smallest population age-wise is our children under 5. Our largest population are adults 35 to 54. But we have a sizable population of people 65 and older. These are poverty statistics by different categories. The 6.6% of our total population is living at or below the federal poverty line. 6.6% of our 18-year-olds are also, 6.5% of ages 18 to 34, 6.2% of ages 35 to 64, and 7.7% of our seniors, or people over 65, are living at or below the federal poverty level. The statistics by race, the 19.5% of our Hispanic population is living at or below the federal poverty line. 10.2% of Black or African American residents, and 6.2% of white residents. And you can just see clearly disparity there, given the low numbers of minorities percentage-wise.
Was there even a, I'm sorry.
Go ahead.
Was there even a percentage on the race for Hispanic? I didn't see that.
There were, I believe they're in the category of other race on that first
Okay.
slide. We take this information from the Census Bureau, and we have to go with however they define things.
Thank you.
Kim, do you know how this compares to the national average? Any of this?
I didn't put those slides in, but we have in those reports that are being passed around, you can see it compared to
Oh, okay.
Rockingham County, New Hampshire, and the United States.
Okay.
I don't think it, I think the United States might be a little bit higher number of people under the poverty line, but
So what's overall, like, when you say poverty, what are you talking about in terms of what they live on in a year's time, on average?
I have a slide that says that.
Oh, you do?
Yep, so we'll get to that. Poverty by education. 2.2% of our residents that are living at or below the federal poverty line have a bachelor's degree or higher education. 8% have some college or an associate's degree. 9.7% completed high school or received their GED. But 47.1% didn't graduate high school. So you can see how the effect of education loss affects our population. And families in poverty. So 4.6% of our Portsmouth families overall have income below the federal poverty line. 2.3% earn less than 50% of that federal poverty line. And families that make less than 50% of the federal poverty level, of them 49.6% fall in that category. That came out a little confusing, I'm sorry. But you compare it to the median household income. These are 2021 statistics, because this was again taken from census data. And so both the federal poverty line and the median household income are 2021 statistics, but the median household income in Portsmouth that year was $91,915 for Portsmouth. Rockingham's a little bit higher, you can see, 101,000 plus, whereas New Hampshire is around 76,000, and the U.S. is $70,784 for median household income. So we have substantially higher income. However, the federal poverty line, where we know we have residents that fall below that, we just talked about, a one-person household, that's $13,788. A three-person family, $21,599. And even if you have 9 or more persons in your household, and they of course have to be related, it's not just 9 roommates, but $56,000 is the federal poverty line. So there's a big gap there that you can see as well. There's some interesting information on veterans. Veterans are 7.1% of our total population, and 10.8% of them in Portsmouth are women. That's a higher percentage than New Hampshire, Rockingham County in the United States. we have a higher percentage of older veterans than those areas as well. And 40% of our veterans possess a bachelor's degree or have higher education. It's the highest of Rockingham County, New Hampshire, and the United States. However, we have a higher percentage of veterans living below the federal poverty line than in Rockingham and New Hampshire. And a very disturbing 2016 study found that New Hampshire had a significantly higher rate of suicide among veterans than the national rate. Detailed information at the county or city level is not available, but the figures were 36 per 100,000 suicides in New Hampshire compared to the 31.7 per 100,000 in the U.S. I'm just reminding people, these are the groups that we're talking about when we say vulnerable populations. You've seen that before. And so I'd like to talk to you about our recommendations that we'd like you to consider supporting or making yourself. So I wanted to make a few concepts clear. That providers of a broad range of services to our vulnerable populations are part of the larger public health system. So daycares, Seacoast Mental Health, Chase Home for Children, Our Place, Crossroads, Safe Harbor, et cetera. And there are many, many more in Portsmouth. These are all part of our greater public health system. And it's really important to support these nonprofits and not duplicate their functions in government. So, that's very important because one of our recommendations is going to be to do exactly that, to support the broader public health. Social, physical, environmental, and economic determinants of health are protective factors of public health, and many city departments and community nonprofits provide these, quote, social determinants of health. You'll see that term used. It's in the ARPA funding guidelines. It's something that we use to talk about the bigger picture of public health other than just health care. And anything the city can do to promote and support social connections, information, and services to our vulnerable populations will make them less vulnerable, and therefore the city overall will be more resilient and fairer. So one of the recommendations is that if this group would consider supporting a community health improvement plan. Now, we've just pretty much completed the community health profile. We're in the middle of the community needs assessment, which will be done by the summertime. The final leg of that would be you take all of that information and you work with the local nonprofits and community members and other stakeholders to come up with a community health improvement plan. And that's a long-term systematic effort to address the public health problems in a community based on the results of the community assessment activities. There are lots of stakeholder input into this. The good thing is, where we had to do so much of the work ourselves, we saved an awful lot of money. And so I don't think we would have to ask the council for more funding. I think we're going to have it left over. So we're just asking you to consider if this wouldn't be a good thing and consider making a recommendation that the council support and approve us to move on to the community health improvement plan.
Has there been one before?
Not that I know of. There's been a community health profile and assessment done something like in 2007. This is the first effort since then that there's been funding to do anything. So even if there were, let me correct that. From a city basis, there hasn't been. There's been lots of local health care related plans, so a specific healthcare entity. Wentworth Douglas has done one. I think Goodwin Health may have just done one. So there are those, but we're talking about sort of a city-based health improvement plan. What can the city and the city nonprofits do, and others to do our part in community health improvement? It's developed collaboratively, and it defines a vision for the community's health. It's important to note that the improvement plan is the community's plan. It's not the city government's plan for the community. Things that influence health are, personal things, genetics, biology, and behavior, as well as access and barriers to health care, but social, economic, service, and physical environments also play a huge role. In fact, while clinical care is vitally important, only a small portion, about 15 to 20% of overall health and longevity, can be attributed to clinical care. It's these social determinants of health that we're talking about that have a far greater impact on how long and how well people live. And so the interaction between health, social factors, and environmental factors is very complex, and it requires a non-siloed approach to policy and planning. These are the non-medical factors that influence health outcomes. Social determinants of health are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of that daily life right here in Portsmouth. These forces and systems include economic policies and systems, development agendas, social norms, social policies, racism, climate change, and political systems, to name several. So one of the other recommendations that we'd like you to consider is to build city services for diversity, equity, and inclusion. Our vulnerable groups have been reporting to us that they feel separated, largely unknown to the rest of Portsmouth, and left behind in Portsmouth's progress. So these are two examples of policy statements or policies that can go a long ways toward building community health. You know, the equity piece here, the city provides all community members with equal and effective services, resources, opportunities, and influence so that all people achieve their full potential and thrive. Equity is purposeful and eager journey toward well-being, because we've talked about that being part of the definition of public health, by those most negatively impacted. Inclusion, the city treats all people respectfully, values all people for their distinctive skills, experiences, and perspectives, engages all people to contribute to the community's success, and leverages resources and city services where needed. Two more examples: sustainability, meeting the needs of current and future generations, and advancing environmental conservation, economic prosperity, and a high quality of life for all. And health in all policies is something I'd also like you to think about. This is the integrated and comprehensive approach to bring health, well-being, and equity considerations into the development and implementation of policies, programs, and services of traditionally non-health related government systems or agencies. Health in all policies is a response to a variety of complex and often intertwined problems, such as chronic illness, growing inequality and health inequities, an aging population, which we have, climate change, which we have, and related threats to our natural resources, and the need to meet governmental goals with shrinking resources. It also yields innovative and effective solutions, a new policy approach, and structures that break down the siloed nature of government to advance cross-discipline thinking for those equitable and sustainable solutions. It is about promoting healthy communities, and it requires that we address the social determinants of health, such as transportation, education, access to healthy food, economic opportunities, and more. I've heard all of those things discussed in this group. And so we're just saying that whenever anybody is putting forth policies or working on these issues, that they remember to include our vulnerable populations in that. Implementation can be very simple, and it can start with when that you include consideration of the impact of that policy on health and the environment, and include our vulnerable populations. Therefore, that brings me to my list of 5 recommendations that I'd like this group to consider. The first one is to support and approve a community health improvement plan to follow this community health profile and needs assessment that's currently underway and based on the findings and greater community input. That's number 1. I have already requested this, and I know that this group doesn't really want to get into monies, but I have asked through my channels if $3 million can be set aside for completion of the community health profile, needs assessment, and improvement plan, so that when we figure out what the best way is to approach all of these issues, and a lot of these issues we'll probably talk about the things we've just been talking about, the transportation, the good food, the employment opportunities, that we have something to work with at the end of that. So that's my second. But my third, and this is very important, because there are groups of people that we heard from a year ago, in last spring. There are nonprofits, local nonprofits, that need assistance now. They needed it then, they're needing it now. There was never my intent to wait for the health department's profile or needs assessment or whatever else may come in order for those groups to be considered. But my understanding is there's no mechanism to get those needs known in front of City Council. I don't, I could be wrong about that, but I've not heard of it. So I would like you to consider asking for a mechanism to be developed so that people who have these needs can get those needs in front of the people that make the decisions about how the money is spent. Separate from what the health department's asked for. Because I have heard people say, oh, well, aren't you asking for that? I'm asking for an end result. These are agencies that have already made their needs known, and there's many more out there that just, that have needs that the council doesn't know about.
But haven't we heard in these meetings, though, that there's no mechanism for disseminating money from the city to the nonprofits? So,
Well, that could be, that's above me. But how, even without that, how do you make those needs known? Because how do those decisions get made if people don't know what the needs are?
And that could be resolved, what you just said. People have to know about that, and that would have to be resolved.
Well, it was about having someone administer grants. Like if we
Right.
did a
Right.
grant
City did
program,
not.
then the city would have to take on the responsibility of administering the
and they,
grants.
But I do think creating some kind of channel that's communicating between the two
Yes.
is a great idea. Whether the city can figure out how to fund the request or not, there should be some way that they can make the request, right, known. So, yeah.
And it's already happening. I mean,
Yeah.
people go in front of the council, make their request, and then they'll get
Right.
disbursement. So maybe just
more
formalizing
streamlining
it,
it, yeah.
and publicizing it.
I have
Good.
people that I've spoken to last year, and said, can you tell me what your needs are? Can you tell me how COVID affected you? And I got things back from folks, but to my knowledge, none of those things have been acted on. And so that, I just mean there needs to be an outlet.
Yeah.
And it's not, I'm a dead end for that stuff,
Yeah.
so.
Yeah.
Is the $3 million set aside, is that just for the profile needs assessment and plan, or is it actually implementing part of the plan?
Oh, yeah, it would be to implement the plan. None of that money is being asked for the health department. It's for, we make a plan and we say that somehow we have persons living at Crossroads that needs transportation to Odioran Point so that they can enjoy the natural
Yep.
environment. We have $3 million to, maybe part of that $3 million could be, okay, how are we going to add that one route, or are we going to get one company to do that? And that's just one example, and I'm just pulling things out of the air here.
So
But
the $3 million is to implement the community health improvement plan when it's done?
I'll explain how it
Okay,
came
sorry,
about.
go ahead.
No, these are great questions. So when the government originally announced that they had this money that was coming and Portsmouth was going to get more than $12 million, there were 4 basic principles that what it was supposed to be used for. And one of them was kind of address inequities for populations that were disproportionately affected by COVID. And we never get public health money. It's just like the last thing to ever be funded. And so just like right after 9/11, I thought, well, maybe this is now our opportunity to get some. And $3 million is 1/4 of that amount because it was 1/4 of the things that they said that we should be using it on. That's how I came up with $3 million. It's not based on any estimates that I have. It just only seems fair to me that public health should have at least that much. And by public health, I mean that community public health, not the health department. Okay. The other 2 recommendations are that if assess and adjust city services to reflect bases in diverse, equitable, and inclusive practices. We really should, this should be part of our ongoing policy, not just on a department level, but if we could ask the city council to really embrace that, and they probably have in many ways that we don't interact with. So I think it should be emphasized, though, if you're willing. And the last one is to apply a health in all policies approach to city policy development and planning. The health in all policies approach, I don't know if I explained it well enough, but what it really is that you're thinking about the health impacts of the decisions that are made. You're also thinking about how can you overcome that disproportionate negative effect on some populations when you're building. So if you're building a transportation system for the whole community, how are you also maybe beefing up parts of it that need to be so that all people can use it? It's really just, it's not that the health department is involved in everything, it's that these global policies are adopted and then applied to, the planning and forward motion of the city. Thank you.
Any questions for Kim?
I've been reading all these different reports, like of what's going on around our country. This is happening everywhere. You know that. I mean, there are areas where, they talk about, 500 people sleeping outside, in the open park or places. And it's just, this is similar what you just talked to us about. I want to read this whole thing. Yeah.
Yes,
the
draft form? Yes, this first needs to go to council. Then when they're happy, or, they've had their opportunity to review it, then it'll go on our website, so it'll be
So
distributed
it's not
that way.
available now on your website?
It's not, it's still in draft form.
Okay.
So,
Okay.
Kim, sorry, the health and all policies thing, it's easy for you to say. Just consider health whenever you make policies. But there must be good ways to do that. I mean, are there, like, here's a policy, we're going to do a new bus system. So first, we make sure that the language is, out there. Is there a procedure?
There are. Cities all over this country already do this. Baltimore, Boston, California cities. Redmond, if you want to look at the Redmond, California website, they have equity, inclusion, and, all the things that we've been talking about here. But that's kind of in the implementation of the health improvement plan. What we really are asking for right now is that the city say this is important, and we want to include health in all policies, or we want that as part of our policy thinking. So we're really just asking for that step, and if the city embraces that, then we have our directive to go forward. And yes, there's lots of information about how to do that.
Okay.
Is there a plan to present this? Is that scheduled, or are they just supposed to read this and then there'll be an open discussion?
The city manager will tell me how to address that. She's on all over that.
Okay, so far as you know, the city council, they have not had this or read this?
You are only the next set of eyes after mine that have seen it.
Wow.
I just want to say, or on behalf of the, committee here, thank you and congratulations on getting through this phase of the project. It's great.
Great.
And I guess I'm wondering, in your opinion, to what extent has the city of Portsmouth taken public health into account when drafting their master plans? If you can.
Well, yeah, public health touches so many realms that there are people that have really tried to address it through things like the sustainability section and all. But really making the bridge between our vulnerable populations and our marginalized population, that has been somewhat missed in the past. But honestly, I can't even recite the whole master plan to you. I'm sure that there's several places that people have put things in there thinking of that. We have a lot of very environmentally conscious folks and, people that have the right framework of mind. So I know it's in there in threads, but it's not stated as such that I know, and I think it should be stated as such.
Kim, can I just ask, I want to make sure I understand the community health improvement plan. Would it be as specific? You gave the example, for example, like of adding a bus route or something to go a certain direction. Will it be that specific? So based on the needs, we want to address these specific things using these community nonprofits we already have? Will it be that specific?
Well, that's a process that is worked out by people at the table that are making the plan. So it's not, I don't have a preconceived notion of that, but I think you do have to get fairly specific because sometimes when you're only talking in concepts, the same old things get overlooked.
Yep, yep.
So I think the more specific a plan is,
Yeah.
the better you can implement.
I just think saying, for us to say that we are recommending it makes like perfect sense, since everything we've been talking about are all these little kind of finite details and ideas, but that would maybe be the plan that's really putting them into place, you know, based on the needs and
That's
everything
right,
else.
and it's also something that can be done in an approach that you don't have to feel overwhelmed. You have to drop everything you're doing to get to a meeting at 12 o'clock on a Tuesday.
Mm-hmm.
You know, it's something where, you know, we can come to you, or there will be work groups, things like that, or there would be. I shouldn't speak as if it's
Well,
actual, but there would be, you know, times when that would have to happen, but there's a lot of individual input, individual work, because that's really where you get your best information.
Right.
You know, my experience of
Doing
this
it,
has
yeah.
been this, and
Yep.
this is how we could fix it.
Yep, okay.
Great. All right, so thank you, Kim.
Wow.
So what we are hoping to accomplish in this meeting is to finalize kind of the process and the timeline for wrapping all of this up and coming up with the final report with some recommendations that will be presented to the city council.
I know. Well,
As far as I know, we only have one other meeting scheduled, right? On the April 18th? That's the only one I have in my calendar. So why don't we, I mean, I feel like it would be helpful to figure out the process and the timeline and then work on recommendations and what will be included in that. But my phone's ringing, so.
Well, because I think when Counselor Bagley came last time, I feel like his recommendation was good, of just kind of, some of the headings he said were too big, like, that we probably wouldn't be able to address anyway, but just kind of creating a list, you know, to present so that they could kind of vote yes or no. So maybe taking what we already have and paring it down. I don't think it's anything new we have to come up with, but.
Yeah, I feel like we got all this information, we started looking kind of pie in the sky, and there's just really not that opportunity through this process, so I agree, if we can kind of come up with some sort of,
Is it an either or, like, I don't know how much money there is, I can't recall exactly.
it's about 5 million.
5 million, but if Kim's asking for 3 million to go against this, and that's going to be narrowed down to what is the need and how do we address the need, are we also talking about setting aside the other?
It's not that clear, because we're not the only group making recommendations either for the same pot of money.
Right.
So
And 3 million is out of the 5 million?
I believe so.
Yeah.
I thought it was separate.
Out of 12, she said.
yeah, I thought it was.
I thought it was
Because then there's,
Yes.
the 12 is what we got as a city.
Yeah.
And then
Why
there's,
do we have 5 that we're talking about?
Because it's already been spent on other things.
there's other things, infrastructure, sewage and water,
So
different
would
things.
we be making specific recommendations that would be on top of the specific recommendation that she's going to be making, or based on the needs assessment?
My understanding is that Kim is asking for this group to include her recommendations as part of our recommendations.
Right, so if
But
we had a
then
list
we'd
of
be
10
the 3
things,
million.
one of the things
Assuming
we
we
were doing.
said yes to that, would we also be adding other specific recommendations based on?
Yeah, things we've come up with during this last,
Yeah.
But then it would
However
just
many
be 2
months.
million.
Yeah.
Right, and then minus the arts and, yeah.
but again, I think they've told us a lot of times that we just make the recommendations and it's up to them to
Right,
vote on them.
right,
so.
like, yeah, I mean, I envision that whatever this final report looks like, it identifies, you know, all of these consistent themes of the pressing issues facing the community, that then there's just some, like what Andrew was saying, was that the kind of the low dollar ones, so the low dollar, high impact, if there's some of those. But I think it's important to mention in the report the truer, larger need
Right.
than
Right.
what we're,
Well, and I think if we have someone, if we present this and we can say some of the ideas, like Andrew talked about the scholarship, or we talked about even funding the website that are the community resources, like just making that more user-friendly. I don't know how much that would cost, but those things, but one of our recommendations could also be about supporting the health improvement. I think we could talk through that one, saying a lot of the ideas we have are going to come out in that report, just to explain that. But that's why we're not also making like all these line item recommendations.
so do we feel like we'll start today, but do we feel like one more meeting would be enough to draft a report and come up with these recommendations?
Yeah.
Yeah.
I think so.
Yeah.
We have number 2 is mental health under public health, remember? So
Yeah, we have
need to
that whole
broaden that.
slideshow.
We need to
Yeah.
broaden
Printed and
that.
didn't bring, but to almost like go through.
Yeah,
things.
so it seems like that might be a good process, is to use the slideshow you created
Right.
to just kind of go through each of the identified areas of need
Because
and
I
come
just
up
was looking
with.
through it before I came, and we have all of the, where we had identified the need, the agencies, the solutions, people involved. So it's almost like if we just go to the solutions.
Yeah.
And what is actually low cost, high impact. Because some things we have on there were really pie in the sky, but we could
Well,
narrow
I think
it down.
that's what Andrew was saying, like housing, childcare, workforce
Yeah.
shortage are just huge.
Right.
So,
Yeah.
but if we were to look at like transportation, for instance,
Yeah.
Right. Yeah.
Yeah, and if we
that,
decided
that
that,
touches all those areas.
Right, and just
Exactly.
kind of make a list of like the top 10, you know,
Right.
from the whole thing.
Right.
Yeah.
Yeah. So Karen also mentioned that the city council meetings where we could present would be, since our next meeting's not till April 18th, it would probably be the May 1st meeting,
Okay.
because we would need to get
You have to get it
stuff
in,
to
right?
them the Wednesday before.
Okay.
So if we meet on the 18th, then the following Wednesday is the 26th before the May 1st meeting.
Okay.
so you're suggesting another meeting just to wrap everything up?
Well, we have the 18th on our,
Right.
Karen sent out a calendar invite for that one.
Okay.
Should we make any kind of like preliminary streamlined product here where we can cross-reference what Kim recommended with our slideshow? Should we just like, along with her recommendations, kind of start with that? Because we know we want to support and back her recommendations, right? It's clear. And then we can get into, okay, and then there's, less than 2 million to put towards nonprofits and then coordinate, and these are our recommendations specifically in these areas, transportation, right? And just draw, should we use, I guess my question is, should we use her presentation as the template and then pull some recommendations from our slideshow?
Well, that's why I'm interested to see when or if she is presenting. I mean, it'd be great if we could present together, sort of. I mean, if she was presenting and then we were like, oh, and also we've been working on
Yeah.
this for 8 months and these are things that we have, but I don't know when or
So
if
I
that's
think we
happening.
need clarification on that, because I don't know if she
Yeah.
is.
Or is that May 1st or before or not, or?
Well,
yeah.
she said she was putting the slideshow in front of the city council soon. I don't know if that
So maybe
is
we can
May
find that
1st
out.
or if that's like a private
Yeah.
meeting or.
Yeah,
Because that would make sense, right?
Yeah.
To go after her.
that would be good.
Yeah.
Because then we wouldn't have to explain what she's doing.
Okay.
Yeah.
Well, and it would show a kind of
It's like a
community
tag team.
effort behind exactly what she's doing with community.
Well, and I do think that even if she's presenting, there could be a section in the report that outlines the recommendations from the public health.
Yeah.
Yeah.
Yep.
Because really, at the end of the day, do we have any recommendations or business with anything non-public health related? Did we identify anything that wasn't,
Oh, yeah, no.
right?
It was the
That's
same,
all.
it's all the
Yeah.
stuff she's talking about.
Yeah.
So, but we don't know.
Do we vote to get behind or not get behind the $3 million she's recommending?
I don't think it's a vote thing, because I think it's just what we are coming up with in our report to recommend. So we can decide if we want to
Right.
But in this
support
group,
that
Are
recommendation.
we saying we're supporting it or not?
Maybe Kim can answer the question about who she's
Yeah.
presenting.
Oh.
Hi.
What's the question?
So the question came up about when or if you're presenting what you just presented here directly to the city council.
I have a tentative time to present to the city council the community health profile, and May 1st or May 15th. I can certainly present this sort of stuff. If there's more that we complete that we think should be included, that will be presented as well. So,
Because we're looking at trying to wrap up and present our report on perhaps that May 1st meeting. So we were looking to see if you were presenting your recommendations directly to the city council and asking us to support those recommendations, or if you were looking to this group to make those recommendations.
Right. I was looking to this group to support those recommendations because I don't think that I am in a position to ask for recommendations of city council. So I'll make a presentation on what the community health profile is, but I think that's the limit of what I should do.
But we were considering that if you did that, then we should follow you, because you
Right.
would have just presented it.
Well, but yes, your charge, though, is to make recommendations. Mine is not.
Right. But
so-
then we wouldn't have to explain what it
Why
is
we're
you're
making
doing,
those,
because
right.
you're going to have just presented.
Yes, I'd be happy to do that.
There you go.
We were just saying it seemed like it would make sense for you to go and then us to follow up with being community members and organizations. We know all of these are needs and here are some ideas and we support this.
In supporting your recommendation.
Yes.
I don't think the date for my presentation is firm yet, so
Okay.
I would just ask the city council, the city manager
Okay.
about those dates.
So even if it wasn't the first, it could be, it doesn't matter.
So I think our question is, when it's firmed up for you, if we can also present on that same meeting.
And have Karen coordinate the date, right?
That's something Kathy
Yes,
you
that
would
would be up
ask
to the city
Karen.
manager.
Yeah, well, she had mentioned the 1st and the 15th of May as
Okay.
the meeting dates, so
Okay.
I think we can just,
And that gives us time also, so if we don't get all done on the 18th, we can,
well, actually,
more.
if it's the 1st, we would need to get done on the 18th because everything would
because it
need
has
to
to be
go.
done before.
Unless we
Submit
met week after.
Will you be using this presentation you've shown us in its exact form at that meeting, or will you be taking out the recommendation slides?
I'll probably be editing it a little bit. This is the third meeting that I thought I was going to attend, so it's changed 3 times, so it's a little, I just want to make sure that it was really nice and crisp.
Yep.
It is great. Okay.
So, I don't know if people up there means that there's public comment, but before we get to that, all right, so it sounds like we're going to keep our meeting on the 18th to really push out some recommendations and get the report going.
Yeah.
And by then, hopefully, we will know whether or not it's the 1st or the 1st or the 15th, and can decide who's presenting and what that looks like. Is there anything we want to talk about today about the recommendations? We have about 5 minutes before we have to go to public comment.
I was just going to say that it might be helpful if people look through what we've already done so that when we come the next time, you could have your top 3, top 4. I'm happy to make another slide and we can just input, discuss, what we want to put on there so that we could actually get it done.
Yeah.
Or if you have some great new idea, obviously, but I think we have a lot of things on there. So, if you pick kind of what's the most relevant to you or your organization or whatever, then we could get that done.
Yeah.
And we can't send those slides out, right? Or can you send the slides out to us?
It's the same slideshow from, that was sent out
Okay.
in
Okay.
November or whatever. I can have her, we can re-share it just so everyone has it
Okay.
fresh.
Yeah, that'd be great.
Okay. Yeah, and then I'll just work on adding a blank slide that we can work on in the meeting to put everything in.
Sounds like a plan.
Does sound like a plan. How do we know if there's people for public comment?
Can they raise their hand?
It's,
Oh,
Rick
wait,
Bexted.
there's a hand.
She's Margaret.
Yeah.
Do you want to?
so, you might have to let her
Do you have
Is he waiting to talk to someone?
No, she's unmuted.
Hello?
Hello?
Oh,
Can you guys hear me?
Yes.
Okay, there's no hand on this version, I guess. So I apologize for that, but I did hear something about public comment.
Yes.
So, if you don't mind, so my name is Rick Beckstead. I live at 1395 Islington Street. I have followed most all of your meetings. Unfortunately, I have not been able to attend them to my workload schedule, but I felt it really important as you're, I guess, getting ready to conclude. One of the things that Council Bagley said about being impactful, I have mentioned this before. I will mention it again. And I know everyone says you can't help with workforce housing, but our workforce in Portsmouth aren't all homeowners, they're renters. And I still think it is very doable and possible at the council level to make a recommendation of, say, $1 million to go and do an exemption program, either for landlords that keep the numbers at a workforce number based on income at the state level for workforce, which is 80% median income, or we go about and actually have renters in the city that meet a criteria and give them an exemption. We do this for our elderly throughout the entire city. We also do this for our veterans. To me, what was asked of this group is to be the most impactful. I understand what Kim is talking about and planning for the future. My worry and concern is it has to be expended by 2026. So it still seems very vague to me for such a large number. And I think it's like $4.7 million you guys have to work with. I think it's something that will be difficult to make a recommendation, especially for the amount of time that you have put in as a group working together. And again, myself and I know most of Portland very much appreciate your time and efforts into this. But I think that would be the big bang. And it's something that the council could very easily do, like I said, with the elderly exemption, with the veterans. I think it's vital and important. I think it would make a huge impact. It could be spent over the next couple of years until it is basically extended by 2026. And I apologize also to Nan Brown. I had a brief conversation with her about it. I was supposed to email her, and I lost the piece of paper she wrote me. So, Nan, I apologize for that.
Okay.
It just, to me, it just, that is the most impactful thing that we can do. Other communities have done that. Manchester, if we need to go and look somewhere else. I know that Mayor Craig, who I know personally, actually devised a plan to be able to do this exemption for renters. It makes an impact. And that's the whole thing. I mean, the pandemic is over, but the result of it is not. We are still suffering, and we're still going to suffer along with everything else that we have in the United States. This would be the most impactful way of doing it. I beg and consider that you guys would make some kind of a recommendation. You lot a number, say it's $1 million, and it could be done through the legal department. They go and devise the plan itself, and the city council with 3 readings can put it into action. So again, I ask that, and again, I thank you for letting me speak.
Thank you.
I hope you all have a good day.
Thank you.
Thank you.
Margot, do we have?
Hi, thank you. Margot Doring, 300 Jones Avenue. I just wanted to pass along my big picture thoughts that you have a unique opportunity with a significant amount of one-time money to think about issues that are so difficult to fix on the day-to-day because they don't fit easily into an annual budget. Low-hanging fruit, things that it's a little here, a little there, those things can happen. It's trying to make these large systemic changes, things that Kim touched on, that need political effort, but then also an amount of money behind that political effort to actually have things happen. I'm not making a recommendation as to what that should be, but I just think there are some things out there that are so daunting that unless there's a concerted effort and the money behind it to actually tip that rock or get it moving, it's just never going to move. And I think you have an opportunity to look at 1 or 2 of those rocks and see about moving them. Thank you.
Thank you.
Thank you.
So I also want, since we only have the meeting scheduled on the 18th, I want to make sure, is everyone here able to be there? Because it would be important for us to have the quorum to finalize a report. Great. Is there anything else before we adjourn? So if everybody can just take a look at the slides and really think about, with the lens of kind of the impact, but also all of these pressing needs that we've identified, and come with your ideas, that would be great. Can I have a motion to adjourn? Anne, second?
Second.
Abby? All in favor?
I
Aye. Thank you.